How does prolactin indicate an epileptic seizure event? Imagine trying to catch a sign that a seizure has just happened. One of the clues doctors look for is a hormone called prolactin. Prolactin is made by the pituitary gland, which is a tiny but powerful part of your brain. When someone has a certain type of seizure, especially a generalized tonic-clonic or a complex partial seizure, prolactin levels in the blood can spike shortly after the event. This spike usually happens within 10 to 20 minutes after the seizure. That quick rise can be a helpful sign for doctors trying to figure out if a person really had a seizure or something else like fainting or a non-epileptic event. The key thing to remember is timing. If prolactin is measured too late, say after 6 hours, it will likely be back to normal, and the test won't tell us much. The best time to check prolactin levels is right after the suspected seizure, within that 10 to 20 minute window. When the levels are checked at this time, a significant increase, often at least doubling from the person's baseline, can strongly suggest an epileptic seizure occurred. But it's important to note that not all seizures cause a rise in prolactin. For example, simple partial seizures or seizures that happen in newborns don't usually show a prolactin increase. Also, if someone has status epilepticus, which is a prolonged seizure, the prolactin response isn't as clear. Doctors also consider other factors that can influence prolactin levels. Certain medications like neuroleptics or drugs that affect dopamine can raise prolactin. Pregnancy, pituitary gland issues, or even stress can also cause higher levels. So, while a spike in prolactin can support the diagnosis of a seizure, it isn't a standalone test. It works best when combined with other tools like video EEG, which records brain activity directly. In practice, measuring prolactin is a helpful piece of the puzzle, especially when EEG results are unclear or unavailable. It can help distinguish between epileptic seizures and psychogenic non-epileptic events, which are not caused by abnormal brain activity. But remember, no single test can confirm epilepsy on its own. The overall clinical picture, history, and additional tests are always necessary. If you or someone else experiences a suspected seizure, consulting a healthcare professional is essential for proper diagnosis and treatment. Prolactin testing adds valuable information but should always be interpreted carefully within the full medical context.